12 signs of having a baby girl. Early signs and symptoms. The anticipation of welcoming a new member into the family is an exciting time for expectant parents. While the gender of the baby may remain a mystery until the ultrasound or birth, some people believe that certain signs and symptoms during pregnancy can indicate the sex of the baby. In this article, we will explore 12 potential signs of having a baby girl, including some early indicators and common symptoms reported by expecting mothers. Before we begin, we want to express our sincere appreciation for your support. By subscribing to our channel and liking this video, you empower us to continue creating engaging and informative content just like this. So let's embark on this incredible journey of safeguarding your child's health together. Morning sickness. One of the earliest signs of pregnancy, morning sickness, is often associated with carrying a baby girl. While it is not exclusive to baby girls, some studies suggest that women carrying girls may experience more severe or prolonged morning sickness compared to those carrying boys. 2. High carrying position. The position of your baby bump may provide a clue about the baby's gender. It is believed that if you are carrying high, with your belly protruding out in front, you may be more likely to have a baby girl. However, it's important to note that the position of the baby bump is influenced by various factors and may not be a definitive indicator of the baby's gender. 3. Weight gain. Some people believe that women carrying baby girls tend to gain weight more evenly throughout their bodies, including their hips and thighs, rather than predominantly in the belly area. However, individual differences in body shape and metabolism can also influence how weight is distributed during pregnancy. 2. Skin changes. Pregnancy hormones can cause various changes in the skin, and some believe that carrying a baby girl can lead to certain skin-related indicators. For example, some women report experiencing acne breakouts or changes in complexion when carrying a 5. Urine color. An old wives' tale suggests that if your urine appears bright yellow during pregnancy, you may be more likely to have a baby girl. However, the color of urine can be influenced by factors such as hydration levels and diet, so it is not a reliable method for determining the baby's gender. 6. Fetal heart rate. Another popular belief is that the fetal heart rate can indicate the baby's gender. It is commonly believed that a heart rate above 140 beats per minute (BPM) suggests a baby girl, while a lower heart rate may indicate a baby boy. However, numerous studies have debunked this theory, as the heart rate can fluctuate throughout pregnancy and is not a reliable predictor of the baby's sex. Mood swings. While mood swings are a common occurrence during pregnancy, some anecdotal evidence suggests that women carrying girls may experience more intense emotional fluctuations. However, it is important to remember that mood swings can vary from person to person and are not definitive indicators of the baby's gender. Food cravings. Cravings for certain foods during pregnancy are a well-known phenomenon. Some believe that craving sweet foods may be associated with carrying a baby girl. However, cravings can be influenced by hormonal changes and individual preferences, and there is no scientific evidence to support a direct link between food cravings and the baby's gender. Pregnancy can cause changes in the breasts, such as increased sensitivity or tenderness. Some people believe that if your left breast is larger than the right, you may be carrying a baby girl. However, breast changes during pregnancy are primarily due to hormonal fluctuations and preparing for breastfeeding, and they do not provide reliable information about the baby's gender. Hair growth. An old wives' tale suggests that if your hair appears dull and lifeless during pregnancy, you may be more likely to have a baby girl. However, changes in hair texture and appearance during pregnancy are primarily influenced by hormonal changes and individual factors rather than the baby's gender. Intuition. Many expectant mothers claim to have a strong intuition about the gender of their baby. While this is purely subjective and not based on scientific evidence, some women have reported accurately predicting the gender of their baby based on their instincts. 12. Ultrasound or genetic testing. Ultimately, The most accurate way to determine the sex of your baby is through medical methods such as ultrasound or genetic testing. Ultrasound scans conducted by trained professionals can provide reliable information about the baby's gender. Usually after the 16th week of pregnancy, genetic testing, such as amniocentesis or non-invasive prenatal testing (NUTET), can also determine the baby's sex with a high degree of accuracy. While it can be fun to speculate about the sex of your baby based on various signs and symptoms, it's important to remember that these indicators are not scientifically proven methods of determining the baby's gender. The only reliable ways to know the sex of your baby are through medical procedures like ultrasound or genetic testing. Enjoy the journey of pregnancy and embrace the wonderful surprise of discovering your baby's gender when the time comes.